that it would be on this side, or it could be on that side, it doesn't matter. So the first thing you should do is you look to see that it's still connected and draining into the bag. You're checking for clots, anything odd. You want to make sure that it's still draining, but if there's anything that's odd, you tell the nurse. But everything looks fine, and State is, of course, is a mannequin, so he's not really peeing. Okay, so we've done that part, and now we'll get started. So a little bit of soap, not really, but at State you really use soap because we're gonna reuse. Okay, so we're washing around the base of the catheter at the meatus where the urine comes out. So that's right there. So in the shape of 2 C's, you clean one side, new area of the washcloth, and then the other side. So we're effectively cleaning the base of the tubing and at the top of the penis where the pee comes out. Then you take a new area of the washcloth and you pinch and hold so it doesn't pull on their bladder. And then you clean the tubing 2 to 3 to 4 inches away.
You're pinching the tip of the penis, or you're pinching
just the
tube?
tubing.
Okay, I was like.
Then I cover, because privacy, this goes in my basket. I'm done with that. Then rinse, same exact way. So cleaning around the base of the tubing, new area of the washcloth, the other side, and then new area of the washcloth, pinch and hold at the meatus, and then 2 to 3 to 4, something like that, inches away. So I'm holding it because if I tug on it, it's going to hurt inside their bladder and it might pull out actually. So covered, then this goes in my basket. We're just going to reuse, that's right there. Then I dry. And you just dry. Just dry. And we're effectively done with that. Now, if you forgot to check the tubing, this might be a good time to do it. Just don't forget, it is a new step that they put in. Also,
do you have to announce it as you're checking it? Do you have to say, I'm checking the tubing?
No, you don't have to. But good thing you asked that. It does say that you must physically pick up the tubing and check to make sure that it's draining.
And just follow it to where it's
just make sure it's draining.
Okay.
And it's all pretend at State, but in reality they would be peeing.
Okay.
Okay, then we cover them back up. And there you go, Mr. Jones. So at this point, you can either take your gloves off and take the base, or leave your gloves on, take the basins to the bathroom, or take them off. It doesn't really matter. You're gonna wash your hands in the end, as long as you do it. But I'm gonna go ahead and just take this glove off and bring the arm down. Put this in his hand. There you go, Mr. Jones. Put the bed back down.
So it's okay if we keep our gloves on after?
Yeah, it doesn't matter. It's their own normal flora. Okay, and about, I don't know, 1.5 feet, leave some space underneath the bed. I noticed this bed was kind of low yesterday, so I open up the privacy curtain, open up the blinds. He is in a position of comfort and safety, right?
Mm-hmm.
And now I'm going to take one basin and put that into this basin. This all goes into my basket. This goes into the toilet. We dump that into the toilet. And rinse water into the toilet, and then set these here to dry. But I'll leave these here. You guys can fill these up. Not fill them, but partially. All right, thank you, Mr. Jones. I'm all finished with catheter care. I'll be back in about an hour. See you later. This needs to go next to the bed. Get used to doing that every time.